The Omicron surge continues to challenge health officials everywhere, including here in Thunder Bay. Several new outbreaks were declared in the past week, and to talk more about the current situation, I'm joined by Dr. Janet DeMille. She's a medical health officer for the district. Good morning, Dr. DeMille.
Good morning, Sean.
Now, overall, how would you describe the current situation facing our community?
Well, unfortunately, what we're really seeing here in Thunder Bay and other communities is the spread of Omicron COVID-19 variant, and overall, we're seeing the cases that are reported to us increase, but we're aware of others who aren't getting, of course, the official PCR testing, who likely have Omicron as well. And, that's manifesting in a number of different ways. So you just mentioned about outbreaks, certainly seeing outbreaks in what are known as sort of higher risk settings, where there can be more implications and more exposure of vulnerable people, and really seeing those numbers kind of increase. And of course, First Nation communities have been in the news with some of the situations that they're facing as well.
Now, this week we learned of an outbreak of COVID-19 at Shelter House in Thunder Bay. Were you prepared for something like this to happen?
We were definitely expecting that would be a population that would be impacted at some point. And, when I provide key, stakeholders sort of updates, I've certainly been, advising them to very quickly prepare for such that eventuality, as our case numbers go up, that, things like that can happen. And you know what? I think there's a really strong partnership here in Thunder Bay, the Vulnerable Populations COVID-19 table that has been in place, almost, I think it's actually over a year, actually more than a year, 2 years now. I think really has a lot of things in place to be able to manage this. And certainly there's a lot of lessons learned from the experience that we all went through a year ago around this time. And it was different circumstances at that time. And so I think that's really, those partners are really active right now in managing this current situation and building off all of the collective experience and the lessons learned. But, it is a challenging situation, and a lot of people are impacted, both individuals and, the staff of those facilities. And, everybody is stretched on capacity issues throughout with because of the surge, and capacity and staffing issues being a big issue. So, it is a challenging time. And overall, I think we're going to be going through this. I noted Dr. Moore said 6 to 8 weeks. That's my kind of time frame as well. Really, it's the next 6 to 8 weeks. Kind of by the end of February, we should be in a fairly significant, different position. But I think it is all of this is going to get worse, and then start to get better. Hopefully by the end of January, but if not, in February.
Now, are there any connections that you may have noticed between what's happening at Shelter House and the district jail?
You know what? Because of the number of cases, and because we're not directly informed of all the cases that are happening like we were sort of more a year ago, it's really hard to draw particular connections. But I think it would be. I mean, it could be part of that issue, the jail, but it also could be the other way around, where there might have been some cases in the population that we weren't aware of, and perhaps they were, admitted to the facility, the correctional facility. But we also know, that it is in any of our facilities or settings where there's an outbreak. It also could be, others who enter that facility, which is staff, and that can happen in any like a hospital or long-term care home or anything, or a school sort of next week. So it's really hard to follow those chains of transmission.
Now, in the past, the provincial government has prioritized vulnerable populations when it comes to vaccines and getting the vaccination. Example of this being First Nations people were considered a priority and given early access to the vaccines. Is this happening right now with the booster shots?
Oh, absolutely. In fact, we started the vaccination. There was always a sort of a health equity lens with the vaccination rollout, and targeting people that may be more vulnerable for a variety of reasons. And I think that was, important part of the rollout. And with respect to the more, vulnerable population here in Thunder Bay, we were, I think as early as February of last year, we were working with partners to provide those vaccinations. And actually we did very well, I think, collectively, ensuring access to, individuals who are homeless in Thunder Bay over the past year, and we continue to do that, and we worked with the facilities as well, and we do continue to do that, and we can be very responsive. So we've had some First Nation communities in rather difficult situations recently. Now, we're moving forward with enhanced sort of vaccination measures as well. So we do have lots of vaccine, perhaps a little bit of an issue with one of the vaccine supplies on the adult Pfizer for 12 to 29-year-olds, but continue to work with our partners to ensure that people have access to first, second, third doses, and there will even be some fourth doses to long-term care coming up.
Now, yesterday, the Minister of Education, Stephen Lecce, provided an update as to what's happening this Monday for students who are returning to school. Part of that update included not notifying parents until there was a 30% absentee rate for people in attendance. Can you explain what that's going to look like? And are you still going to be recording outbreak? Will outbreak still be declared? Because the current definition of an outbreak is if there are two cases with an epidemiological link. Is that still going to be the same process?
That's a really big question. So the whole approach to schools with COVID has really changed very significantly, even from what we were doing in November when it was the Delta variant. And really, the Omicron variant has given us, but because it's sort of overall a bit of a milder in terms of its impact to particular individuals, there is sort of an opportunity to not be so aggressive with case and contact management with the school settings. And so it will be substantially different, where we really, as public health, won't have a really good understanding of what's happening with COVID in the school setting in terms of cases and contacts and outbreaks. So it's going to be other measures like overall absenteeism that will provide us some guidance or direction around what's happening. And really, because of the overall surge, we wouldn't even have the capacity to do the follow-up that would be necessary anyway. I, though, think it is important that schools be reopened next week. You and I talked about this last week. There are a lot of measures in place that will make schools, as safe as they can be in the context of this Omicron surge. The reality is, though, that there will be cases in the school setting, individuals who have COVID, and that could be anywhere from a young child to an older high school student to staff who may be unaware that they have it and that they're in the school setting. But the measures that have been put in place in schools and the vaccination rate, which is primarily those 12 years of age and older, will help to protect those school settings. It is also important, though, that parents do their part, do that school screening. Do not send your child to school or childcare if they have any symptoms or for any other reason through the school screening that they shouldn't be at school. So, and the truth is, children in many ways were, and I do anticipate this will be the same next week, are more likely right now to be getting COVID outside the school than they are within the school. But we can anticipate that there will be people, absent from school because they have symptoms, and it could be COVID-19. And with the measures, hopefully, we'll be mitigating, spread within the school setting. But, it is a challenging situation, and I recognize that parents may have concerns about that. It is so important as well, though, that schools be reopened.
Now, part of yesterday's announcement also include the announcement that 2 rapid antigen tests are going to be going home with staff and students. Would you make the recommendation that these should be used as a screening guide for students when determining whether or not to come while displaying symptoms of COVID-19?
Yeah, so I think that's another tool that we'll have in terms of the screening that can be done for anybody going into the school setting. So not only is there the screening where you go through and answer questions, and certainly anybody who has any symptoms should not be going to school in the first, that just as a general direction. But there will be the availability of some testing opportunities. So we do have those PCR self-swabbing kits that will still be available as supply allows. That's another tool that will be provided. So anybody in the school setting who has symptoms, some of that will be the PCR tests that will be done at home and dropped off at a drop-off point. But there will also be rapid antigen testings, and I don't actually know. I know that there was some sense that there will be 2 tests, but I think that there might even be more, and that can be used with students or staff who are symptomatic. That can confirm if they have COVID-19, if that test is positive, and that just provides the parent and that individual a little bit more information about what might be going on. But still, regardless, even if the test is negative, if they have symptoms, they should be staying at home. So on all of these testing issues, we are expecting more information, and we are, of course, expecting the schools to have more information from the Ministry of Education about how much the tests, how much they will be getting, how to distribute those tests, and of course supporting, parents and students when they use the test, how to interpret and manage the results.
This week, the Northwest Health Unit advised people that they should be prepared and have groceries and other supplies ready in case they need to isolate. What do you make of this message, and is it one that you'd like to echo to the people here in Thunder Bay?
So I think, my main message is, what we've talked about is that we're really in the heat of this Omicron surge right now, and the numbers are really, going to get worse, even though we won't necessarily know what those numbers are. And everybody has to do their part so that we can effectively navigate the surge and come out the other side. And that will be requiring a lot of people to stay at home for different circumstances. And if you actually go to it's the ontario.ca/exposed website, it provides a lot of the direction about when people should stay at home, and even household members will need to stay at home a lot. So the reality is many of us over the next 6 to 8 weeks will have a period of time where we should be staying at home, either because something that's happening to ourselves or because it's within the household. And that will help, manage the surge in our area and slow down the spread and protect people. And so I do encourage people to have those conversations within their households and if they're in their workplaces, about what is going to happen and what do you need so that you can effectively stay home. And most of the time it will be about 5 days. We're not doing the 14 days. Some people may be directed to stay home 10 days, but, it is a shorter period of time. But think about how you would manage in your own household to accommodate that. So, I have kids at home and a household, and I've had that conversation, and we sort of navigated through, how would we, kind of manage that. And, the kids can still attend online schooling if that's an option available to them and they're well enough to do that. And certainly in terms of the workplace, navigating that conversation in the workplace. I know we, even in public health, have had staff that are unable to come into work and, including in our immunization clinics. So we've had to put some contingency plans in place. So being prepared to be at home. The other thing is support one another. If you have friends or family or neighbors even that, what can you do to help them, or how can we all work together to help each other kind of meet what these directions are? So that would be overall my message.
Thank you so much for joining us, Dr. DeMille.
Thank you very much, Sean, for the opportunity.
That was Dr. Janet DeMille. She's the Medical Officer of Health for the District of Thunder Bay.